Hi, my name is Richard, and I am a counseling psychologist here in Ontario, Canada. And one of my special interests is in the treatment of trauma. I use a variety of tools, a variety of strategies and techniques to help a person heal and get treated from the traumatic event. But one tool, one intervention I continually fall back on is EMDR, which stands for Eye Movement Desensitization and Reprocessing. It's a big phrase, and what I want to do in this video is go through each of the letters, explain to you what EMDR is, and hopefully that'll give you a little more understanding and seeing if it's a good fit for you with some of your treatment goals. Now, regardless of the therapist you work with, therapists typically have one main goal in the treatment of trauma, and that is to help you become desensitized or habituated to the traumatic event. So what this means is that when you think about that traumatic event, it just doesn't bother you physiologically, that you find yourself no longer reacting to that traumatic event. It's not to say that you'll ever forget it. That's probably unlikely, especially if it was a very highly charged emotional event. But what this means is that you are no longer affected by what happened to you. So that's pretty much what the letter D in EMDR, the desensitization, stands for, is that it gets you desensitized to the event. So when you think about it, it just no longer bothers you. You no longer react to it. The letter R in EMDR stands for reprocessing. And let me explain what that is. Oftentimes, when a traumatic or a painful event happens to us, it affects the way we see the world because it affects what we believe about ourselves. And then what ends up happening is from that point forward, from the time of the distressing event, from that moment forward, the lens you use to go through the world, to interpret the world and interpret the way things happen, are all coming from that lens or that belief that you have about yourself. So here's an example. Let's say when you got into a fight, you were assaulted. As a result of that event, you might adopt the belief that people can't be trusted, or I am always in danger, or the world is a dangerous place. So you can imagine what your life will be like, what your interactions and relationships might be like if you go on through life interpreting and perceiving things from that belief. So what the goal is in dealing with EMDR is to reprocess what you believe about yourself so that you have a more, just a more grounded way, a more realistic and balanced way of looking at yourself and looking at your world. So that's what the goal of the letter R in EMDR stands for, is to reprocess what you believe about yourself. Now, the letters EM stands for eye movement. And I think this term eye movement is where not so much controversy, but where people have a lot of opinions on the scientific basis behind EMDR. So let me just explain to you what I think it means and the role it serves in the treatment of trauma. Whenever somebody is in the process of going through the desensitization, so whenever they start to think about the event, what often happens, especially in therapy, is that the person might start to dissociate. And what dissociation means is that although you're physically there, you're physically present, mentally and emotionally, you are back at that event. So let's say I ask you, do you remember what happened when you were 12? Can you tell me about that traumatic event when you were 12? Even though the person is sitting comfortably in my office, mentally, they're back at that age. They're back at that stage of when they were 12. So in other words, what we want to do is to prevent dissociation and keep them grounded in the present tense so that mentally they can go back in time and work through that event. That's what this eye movement does. Now, some people use eye movements where they make you follow the fingers as you think about those events. Because of COVID and EMDR therapists had to work virtually, what we adopted was sometimes what they call like this sort of butterfly technique where you just tap left, right, left, right. Sometimes I might ask them to just tap their knees as they're recalling the event. It could be a variety of things. We just sort of call it bilateral stimulation. And what this does is that, again, it just helps to prevent the dissociation. It helps keep the person grounded in the present moment so that they can work through those events. And to explain what EMDR is, to summarize it, this is how I would describe it. It is a very structured approach to imaginal exposure. So psychologists who operate maybe from a more behavioral model or cognitive model, this is what EMDR is. It's a very structured way of exposing yourself to some of these memories that helps with habituation, desensitization, and the way a person reaches those goals is through accelerated processing. And what I mean by that is, if you never go see an EMDR therapist, if you never go see any therapist for the rest of your life, chances are, in time, 5, 10, 15, I don't know, maybe 20 years, that memory, that traumatic event will affect you less and less and less over time. But what talking to a therapist, whether you use EMDR or whether you use cognitive processing theory or any other intervention, what these interventions can do is that it accelerates the way you process that traumatic event so that the healing happens a lot more quickly. I hope this video helps in your understanding of EMDR. Check out my website, psychologyforgrowth.com. Book an appointment there. And if you live in Ontario, whether virtually or in person, I'd be happy to work with you. Thanks, stay safe, and take care of yourself.